Today I bring you a video that I think will be really helpful when you've had some trouble with your ankle. Maybe an injury, not too serious, but it hurts a little. The ankle is a little swollen and you want to know what you can do in these cases. So don't miss it. Let's get to those tips. What can we do? Well, first of all, if it's an injury that I suspect is something important, ideally I should have it checked by a healthcare professional. That's the first and most important thing, lest we overlook an injury that we should take into account. In general, what could have happened to us? Well, generally, we may have had a small ankle sprain and it hurts a little. But it's not a very important injury. I can put weight on my foot, I can walk, but I have a little pain. In that case, at first glance, it wouldn't seem like a very important injury, but hey, it's best to clear up any doubts. But if I've had that feeling, I have a slightly injured ankle, there may be a little swelling, we can start using some of these tips. Also, when I've had an acute ligament injury, which has already been diagnosed and supervised by a professional and I'm not wearing a bandage at the moment, this type of work will also be very helpful. We'll keep in mind that we're never going to mobilize the ankle. We're going to use techniques that will help us with that inflammatory process that has occurred. So, we're talking about being in an acute or subacute phase. Also, when we have pain associated with a pathology, it could be, for example, a previous pathology. I have pain especially in the area surrounding the outer part of the ankle. We're going to do work mainly focused on increasing blood flow. So, it will be very helpful. We can also use it when I have a lack of mobility. It's not a specific mobility work. For that you have other videos on our channel that you can use to complete this proposal. But we can use it for those people who have a lack of mobility, as a previous phase. And also when I can't do a full load, I can't put weight on my ankle, but I want to give it a boost so that the muscles can be well oxygenated, so that there is no lack of oxygenation, no lack of irrigation in the area while I'm not putting weight on my foot. So, in all these cases, we can follow the tips we're going to see next. When is it not appropriate? When I have a significant injury, well, I've had a major sprain. There's a lot of swelling and inflammation, a lot of pain. No professional has seen it yet. So in that case, we need to be very careful about what we do. Let's wait until we get it looked at, lest we aggravate the injury a bit. It doesn't replace a professional evaluation and treatment. When I have significant vascular problems, we're going to do techniques that primarily seek to increase irrigation and venous return. So when I have significant vascular problems, I'll be extra careful. If, for example, my ankles swell a little at the end of the day, there's no problem in this case. We're talking about a thrombosis, which is a bit more serious. Like any other massage, as I'm working over the entire surface of that ankle, that foot, if I have significant wounds or have a skin problem, any infectious or contagious pathology, as always, we're not going to focus on that area. Especially when I have, imagine you've sprained your ankle and on top of that you've fallen and have a wound. In that case it's better not to touch it, at least for the time being. So if that's not your case, but rather the opposite of what we saw before, let's start to see what we can do. The first thing we're going to work on the most are superficial rubs. Especially those superficial rubs, we're going to do around the malleolus. The malleoli are the little bones you're seeing in the image, the ankle bones, where those ligaments that can be affected will be inserted. So what we're going to do are some superficial techniques around our entire malleolus. We're going to go more anterior, more medial, more posterior, and work through that entire area. We're also going to do superficial rubs on the top of the foot, on the instep, and on the sole of the foot. So that's going to be our fundamental maneuver, superficial rub. Once we've done all of our rubbing maneuvers, we're going to do muscle activation. Here it is very important to keep in mind, especially if there is an acute or subacute injury, in which they do not recommend that we mobilize the foot. What we are going to do is an activation. It is said to be isometric, that is, I make a little bit of force, but I do not change the position of the foot. So, I maintain that position. In this case, as you can see, we create resistance in the sole of the foot and ask to make a little bit of force against the hand, so that the muscles are activated, but the ankle does not move. You will see that we are going to do this in different directions. And finally, we are going to finish with an active mobilization, but not of the ankle. Not of the ankle, let's be clear. We are going to move those joints that are above or below, but not the ankle joint. In this case, above all, we are going to do mobilizations of the toes. We are going to open the toes, close the toes, and move the little toes. With this, we activate all the muscles of the toes and send the blood upwards, and this will help us oxygenate the area and reduce inflammation. So, let's get started. Because we are starting with these suggestions for our ankles. Well, as I said in the theoretical part, we have to be very careful here with when and how we put our hands. Keep in mind that if there is really an acute injury because it has just happened, the ideal is always for a professional to see it. But if a professional has already seen us and we are not wearing a bandage on the ankle, or it is a very low importance injury, we can work on some things that will improve or help us improve. We have to keep in mind that the ankle can hurt. So, if the ankle hurts, what we have to do at all times is to avoid the foot falling downwards or inwards, because this is what will increase the pain. So, as far as possible, we are going to try to keep the ankle as if we were supporting it. That is, at approximately 90 degrees. It can be a little bit less, but we are never going to let the foot fall, as I always say. So, once we have the foot properly placed and we are going to be correcting the position if necessary, we are going to start with those superficial rubs with a little bit of cream. We can use a cream that has some anti-inflammatory component that will help us work a little bit with that sensation of immobilization. So, if we use a cream that has some arnica or anti-inflammatory component, it will be very helpful. Very carefully. Here we are going to use superficial rubs, but truly superficial. We are not going to apply any pressure at any time because what we want is to improve a little bit the circulation, but not to produce any pressure that could increase the pain of our partner's ankle. So, what is the best way to do it? We place ourselves on both sides and we are going to start from the bottom, making small circles on both sides of the ankle. We start from the bottom and we are going to gradually go up. As I tell you, always being very careful not to move the foot. We are going to try to keep the foot as stabilized as possible. We are going to get closer to the ankle and we are going to stay in this anterior area, which if you look at my left hand, is where the ligaments are located, the anterior talofibular ligament. What does this mean? The external lateral ligament. When they tell us I have an ankle sprain in the external ligament, it usually starts here, in this area. So, That's why we are going to massage this area very gently. We are going to move to the next one. In this case, it is below the ankle bone, below the malleolus. We are going to stay here with very little pressure, simply making those superficial circular rubs. We stay. And now we are going to the next one, which in this case is the posterior. We are going to go behind, more towards the heel, and from here, the same, we are going to make circles with our fingers. We do it both inside and outside to improve that subjective sensation of pain a little. We can start again. We go from the anterior zone, the middle zone towards the calcaneus, and the posterior zone. Circle, circle. We pay attention to the position of the foot that we have not moved, and we are going to do it again. Circle, superficial rubbing in this area without pressing at all. We go to the middle zone and then to the posterior zone. Once we have covered all these areas, we are going to go to the most distal part, towards the metatarsals, and we are going to make those superficial rubs on the instep and the sole of the foot. Super gentle, without changing the position, without pulling the toes down. All the time maintaining that position and very gentle maneuvers. We can go a little further towards the sole of the foot. Same, very gently, everything super gentle. And we go back up. We can make a maneuver with both thumbs towards the ankle to promote that return. We take our ascending movement and we are going to the sole of the foot gently. Once we have done all our maneuvers at the instep level, we are going to go back up with global movements. I go from the instep, up on both sides towards the leg and down in the back. I go up on the instep, I go through the entire ankle and leg, and down in the back. I go up from the top, circle around and down. 2 more, up, down. And the last one, up and down. Once we have done all these movements, we are going to do muscle activation. This activation, as I have already mentioned, is going to promote that blood pumping to favor the return. So, from here, always maintaining the position of the foot, I am not going to let the foot drop. I maintain the position. I am going to ask it to make a little bit of strength. It's muscle activation. From here, I push against myself. It makes a little bit of strength and relaxes. Again, strength, relax, 2 more, strength, relax, and the last one and relax. I'm going to change the position. I'm going to place my hand on the outside and I'm going to ask you to push towards the side, force towards this side here towards your pinky. There, and relax. Force there and relax. Force in that direction and relax. 2 more and relax. 1 more and relax. Let's go in another direction. I place my hand here. You're going to push to bring your toes towards you, with the whole foot, with the instep, and relax. Again, relax. To that side, force, relax. 2 more, relax. And the last one, relax. And for now, we're not going to ask for movement inward. We're going to leave it here. Once we have done these maneuvers, we can go back to superficially massaging to do some intermediate maneuver. And to finish, we are going to ask for an active mobilization. In this case, we are going to maintain the position of the foot all the time. Remember that we don't let the foot drop. And from here, we are going to ask you to move your toes. There it is. I separate the toes, relax. I separate the toes, relax. 3 more, relax. 2 more, relax. And the last one, relax. From here we relax the area a little bit more, release it, and we are going to decrease the tension until we finish. With this, we would finish our intervention to release that area a little bit, especially that sensation. Remember that everything we are looking for is a feeling of well-being and increasing blood circulation that will help us to better address that injury. Another thing that we could add, in case we have more time and want to extend it a little bit, is to massage the entire back of the leg. It's going to be very good for us or to give a massage in this lateral area of the leg, in the peroneals, because when I have this ankle injury, the peroneals are usually quite tense. So, it would be very good to release this area a little bit. If you want to work a little more, if you want to look for some other exercise, know that on our channel you will have exercises related to ankle injuries. So, I invite you to take a look at those videos that we have from other colleagues, and if you haven't done it yet, you know you can subscribe so you don't miss anything. See you next time, and I hope you liked it.